Beginning March the 18th, Algerian authorities announced that they were going to quarantine confirmed cases of COVID-19 patients within special hospitals, while enforcing a curfew between the times of 3 p.m. and 7 a.m. Now, GE Healthcare's Life Care Solutions teams, which are responsible for ventilators, monitors, ultrasounds and more, have been helping the Algerian government create and equip these quarantine areas for COVID-19 patients that are around 40 miles outside of Algiers. Samy Izem in Algeria was there, and I spoke to him earlier on about his experiences in supporting these hospitals. How has COVID-19 affected Algeria?
And Algeria is closer to Europe. So we are just looking that Europe has been impacting and no patient affected in Algeria. And it started to be like up in one shot. We start to have 1, 2, 3, 4, and then it started to be increasing. The country is looking down.
And Samy, what is your role?
And our role here in Algeria within the healthcare is to help the government and to help the hospital to support in order to have more people diagnosed through our devices, through the CT, etc. We are supporting the government to have a quarantine area. We are installing our ventilator there. We are making the system apps and making our scanner CT.
Can you tell me a little bit more about the quarantine areas?
So Blida was the first hospital where the government decided to do the quarantine area. In the Blida, we have several segments. So at that time, the government asked us to support them in order to have a current quarantine area dedicated to the COVID. And at the meantime, so we know the COVID, this is respiratory, and to put in place those medical devices.
How long did it take you to get the equipment to Blida to set it all up, to get it operating?
Yes, Blida, it was the first one. You need to know that the government was putting, we've been challenged from government in order to make it quickly. So we did it from our side in 2 days, and it took like 1 week in order to make everything ready. And it was in 2 days, yes.
And were there more hospitals outside of Blida that you had to support?
We have several hospitals. It started with the Blida and then extended to all other hospitals. And including the private as well. So we don't have enough kit to do the diagnosis. So we jumped to the CT. Now everyone is calling us, private and public. We are working with all town, not only with the Blida. And we have several quarantine area where we need to go there.
Samy, what have been the major challenges for you during this pandemic?
So the biggest issue at that time, it was like, we just started to have a COVID affecting people in Algeria, and we have lack of information. What should be done? Who should be with us? How can we make sure that we have the right devices installed on the right places? Are they doing the disinfection on time? Are they going to manage the process, to have the good process for disinfection, etc.? That was kind of a challenges.
Your work tempo, Samy, seems relentless. How are the teams doing? How are you doing?
So it was the first time we were facing this type of situation, and this is around the world. When I was discussing with the team, I said, guys, today, I don't feel that I'm working with a team. I'm working with a hero. To be honest with you, when I'm receiving a call from the ministry, when I'm receiving the call from the customer claiming that he has more than 50% patient for the COVID, I need the support. Definitely the team, they tell me, okay, Samy, we will go there. No worry for that.
How do you think you'll reflect looking back on this moment?
Let's say that I'm a little bit proud and happy to see that we can give something for the healthcare, for the patient, etc. Are we doing enough? Can we do more? How can we do more, etc. And this is an obligation for us, because today reality is there. It's not going to disappear just like that. So we need to do it.
And when do you sleep?
Oh, it was since a long time we didn't sleep. So I'm sleeping when I know that my team, they are at home and everyone is safety.
Samy Izem, remarkable insights. Thank you.